digital technology that we have available in our office that will help us generate or create beautiful, great fitting crowns for patients that they can actually have fabricated here in the office and actually inserted the same day that they can go home with the permanent crown, so they do not have to come back for a second visit. But what the technology does is it basically allows the computer to help assist designing the crown to the proper function of that specific patient's mouth, and fit the tooth with such precision that I'm just really impressed with. It's been around for around 20 years or so. It's very well designed as far as the way that the technology works, and very well accepted, and is very successful. And so what we also then can do is, once we design that here, we'll send it to a milling unit right here that takes a block of ceramic and creates that crown here, where then we can custom glaze and stain it to match the patient's tooth, and they can go away and have a permanent beautiful crown when they leave the same day. You know, most patients are, in most areas of the mouth, there's enough room. And that's really the factor here. For us to be able to have the strength of maybe, say, an all gold crown. Gold can be very, very thin and still be strong. Most patients, though, are trying to get away from the metals in their mouth and want to have something more aesthetic, so they want to go to the all ceramic. It used to be that we would have to put that porcelain and bake it over a gold structure. But now that we've come out with Emax, which is a type of ceramic that has the strength of the porcelain crowns, or very nearly the strength of them, we can use those in most places in the mouth. Now, somebody that's maybe a very, very heavy clincher or grinder, that might be the person that you might want to still go with some of those older type of, I shouldn't say older, different technology or different materials that are known for their strength in the high wear areas of the mouth. So really it's about how much room do you have and how strong do you need them to be. But for 90% of my patients, I would say even 95% of my patients qualify for a CEREC crown, because we have the ability to make adjustments to things in the mouth to make that work. They're right in line with all the crowns, as far as the different materials. The thing that's good for patients with the CEREC crown is, they'll be billed to insurance the same way, and they'll get the same coverage for whatever percentage the insurance is going to cover, they'll cover for the CEREC crowns. I think the big advantage for our patients to have the ability to have a CEREC crown is they only need to miss work once. I know how busy our patients get. It's difficult to get time off work, and so if they only have to do it one time, it definitely, I think, adds value to that crown.